urogenital triangle first. Okay, the one orange ni. This is the urogenital triangle. The purple is the anal triangle. This is in lithotomy position. Okay, kita tengok dari interior. So okay, so it's anterior half of the perineum, bounded by pubic symphysis, ischiopubic ramus, and interischial line. So it encompasses the scrotum and root of the penis in male. Okay, scrotum and root of the penis in male, and extend to the lower limit of the labia. Okay, I will teach you in female reproductive system. Okay, this is labia, lower limit of the labia. Okay, here up to the mons pubis in female. This is the limit of the perineum. Urogenital triangle. Okay, what are the components? The structure inside the urogenital triangle, okay, are the two space or pouch. Some book called space, some books called pouch. So it's deep perineal pouch and superficial perineal pouch. Okay, perineal fascia and skin. Ini dari dalam ke luar, dari deep ke superficial. Deep perineal pouch, superficial perineal pouch, the fascia and also the skin. Okay, the pouch. I hope you can imagine, you boleh appreciate yang ni yang lain putus-putus the pouch satu superficial, yang paling luar, yang paling dalam yang cover the muscle ni is a deep. Okay, so dia yang lain putus-putus lah, dalam tu is a space, a pouch. Okay, superficial perineal pouch here, the potential space between the perineal membrane, okay, perineal membrane kat atas, and also superficial perineal fascia dekat bawah. Okay, perineal membrane tu ataupun nama lain the diaphragm. Okay, sekarang ni deep superficial perineal pouch, deep perineal pouch. Dah lalu ke dah terangkan kan perineal membrane? Belum Okay. Okay, I think sepatutnya I can present dulu deep perineal pouch. Okay, can we go to the deep perineal pouch first? Okay, this is deep perineal pouch. Okay, it's a potential space between superior fascia of the urogenital diaphragm. Okay, this is a urogenital diaphragm present here. Okay, urogenital diaphragm present in the urogenital triangle. Urogenital triangle ada urogenital diaphragm. Okay, so urogenital diaphragm ada superior fascia and inferior fascia. Superior fascia tak ada nama lain. Inferior fascia we call it perineal membrane. Okay, nama lain of the inferior fascia of the urogenital diaphragm. Okay, so deep perineal pouch ni kat sini space between the superior fascia of the urogenital diaphragm and perineal membrane. Okay, so dalam deep perineal pouch ni ada urogenital diaphragm. Okay, superficial to the urogenital diaphragm is the deep superficial perineal pouch. Okay, this is superficial perineal pouch between the perineal membrane kat atas, and the inferior part is the superficial perineal fascia. Okay, so this is the boundaries of the pouch, two pouches that present only in the urogenital triangle. Anal triangle tak ada this pouch. Okay, so this pouch only present at the urogenital triangle, and ada deep and superficial. Deep perineal pouch ada urogenital diaphragm. Ada lagi structure lain, I will present later. Okay, and also superficial to deep perineal pouch, that's present of the superficial perineal pouch. Okay. Okay, now I will explain what is the urogenital diaphragm yang present dekat deep perineal pouch tadi. Okay, this is urogenital diaphragm. Triangular, trilaminar, musculofacial structure sandwiched between two layers of fascia. Kan? Upper superior fascia and inferior fascia. Inferior fascia nama lain dia perineal membrane. Okay, so this urogenital diaphragm ada muscles and also ada pouch. These are the muscle, deep transverse perineal muscle. Okay, and also external urethral sphincter. Okay, I hope you remember your external external urethral sphincter. Okay, during the urinary, the external urethral sphincter is one of the contents of the deep perineal pouch. Okay, and also one of the content of the urogenital diaphragm. Okay, so it's also composed of the deep perineal pouch. Okay, deep perineal pouch also is one of the components of the urogenital diaphragm. Okay, macam lebih kurang lah. So the urogenital diaphragms composed of the two muscles and also deep perineal pouch. Okay, so urethral sphincter is a striated muscle and also smooth muscle. In female, ada compressor urethra and also sphincter uterovaginalis. If female, just encircle the membranous urethra. Okay, and the smooth muscle also, circularly oriented smooth muscle cell actually is present as well in the present as well as at the urethral sphincter. Okay, so I believe kita belajar dekat urinary. For male, the external urethral sphincter is located at the membranous part of the urethra, and it's located at the deep perineal pouch. Okay, so both sex, male and female, the external urethral sphincter is located at the deep perineal pouch. Okay, so these are the detailed component that present in the deep perineal pouch in female. Tadi kita dah cakap muscle of urogenital diaphragm. Okay, now the proximal parts of the urethra. This is the urethra, proximal part of the urethra kat sini. Okay, part of the vagina here, upper part of the vagina. And then the dorsal nerve of penis and dorsal nerve of the dorsal vessel of clitoris. Okay, tak ada kat sini So during female reproductive system you akan encounter the dorsal nerve of clitoris and deep dorsal vessel of clitoris. So these are the components of the deep perineal pouch. Okay, how about in male? Okay, again, dah cakap tadi muscle of urethral diaphragm. Okay, you know in the diagram, membranous part of the urethra, and now ada gland. Okay, corpus gland. Okay, this is the corpus gland or bulboureteral gland. It's located at the deep perineal pouch. Okay, dorsal, sama macam female, the presence of the dorsal nerve of penis and deep dorsal vessel to penis. Okay, ini baru deep Okay, now what are the fascia that present? Okay. Superficial perineal fascia atau namanya collis fascia is continuous with the skin of the scrotum or labia, okay, and runs anteriorly and superiorly into the skin of lower abdominal wall, continuous with the stapes fascia. Okay, that is the collis fascia. Dia ada lagi lain, deep perineal fascia is overlies the muscle of the perineum, okay, and anteriorly fused with the suspensory ligament of penis or clitoris, fascia of the external abdominal oblique and rectus sheaths. Okay, so ada superficial fascia and deep fascia. Okay, so superficial fascia yang ini biru, and also the deep fascia yang warna hijau. Okay, so these are the fascia that present in the perineum. It will connect in the abdomen and it also will connect with the scrotum or labia. Now, what are the components of superficial pouch pula? Okay, this is in female. Okay, part of the vestibule and surrounding bulbous progerosus muscle. This is the male, female. This is the bulbous progerosus muscle, and there's a bulb. It surround the bulb of the vestibule. Nanti I explain during the female reproductive system. Vestibule, bulb of the vestibule is not here. And then the crura of the clitoris. It's not here. Tak apa. I think you just remember in the female reproductive system. There's a crura of the clitoris associated with the ischiocavernosus muscle. This is the ischiocavernosus muscle. Okay, this is the clitoris somewhere around here. There's a presence of the crura. The crura is enveloped by this ischiocavernosus muscle. Okay, Now ada superficial transverse perineal muscle. Tadi ada deep transverse kan. So now there is presence of the superficial transverse perineal muscle. Okay. Greater vestibular gland. Okay, greater vestibular gland here is it actually is homologous with the corpus gland in male. Tapi corpus gland in the deep perineal pouch. This greater vestibular gland is located at the superficial perineal pouch in female. Okay. And also the branches of the internal pudendal vessel and branches of the pudendal nerve. Okay, how about in male? So bulb of penis, okay, ingat kalau bulb je akan di-enveloped by the bulbous spongiosum. Pleura is enveloped by the ischiocavernosus. Tak kisahlah male or female. Okay, so bulb of penis. Okay, this is bulb of penis and these are the muscle. This is crust of penis and this is the muscle. Okay, so these are located, this belong to the superficial perineal pouch. Okay, sama ada superficial transverse perineal muscle. Ada ke? This one right? It's not sure ya. Benda macam female lah dia ada superficial transverse perineal muscle. Okay, now ada proximal part of the spongy urethra. Okay, branches of the internal pudendal sama branches of the internal pudendal vessel, branches of the pudendal nerve. Okay, so boleh ingat kalau saya tanya contents of deep and superficial perineal pouch in male and female. Kena tahu lah. Okay, now perineal body. This is the perineal body. In the fibromuscular tissue at the center of the perineum. Located at junction of the urogenital triangle and anal triangle. Okay, and posteriorly is merged with the external anal sphincter fibers. Posteriorly merged kat sini, and anteriorly deep and superficial transverse perineal muscle and bulbous spongiosum. Dia macam merge. Continue with the raphe of the scrotum in male, and posterior of the commissure of the labia majora and the vaginal orifice in female. It's continuous like that. Okay, here sama orang. Okay, it's okay. I will explain again in the male and female reproductive system. Okay, a bit of the applied anatomy. Episiotomy during the vaginal delivery. Okay, usually the gynecologic obstetrician perform the cut or at the vagina to allow the delivery to be smooth. So we perform the, nanti you masuk ONG posting nanti you have to observe the episiotomy. Usually we perform angle laterally is medial lateral episiotomy. Okay, to avoid injury to the sphincter. Okay, so what are the insertion that been made? Okay, first vagina and then transverse perineal muscle. The bulbous spongiosum, some of the book called bulbous cavernosus. Dia banyak-banyak term. Okay, it's the same. Bulbous spongiosum muscle, and then perineal skin. That's the layer to be cut during the episiotomy. Okay, perineal muscle, superficial transverse perineal muscle. Okay, this is superficial transverse perineal muscle, occasionally small or absent. Bulbous spongiosum muscle, some of the book called bulbous cavernosus muscle, lies in the midline in male. Okay, empty the urethra of the urine, assist in erection and expulsion of the semen. Okay, later in the male reproductive lecture, how the ejaculation. Okay, so this muscle, the bulbous spongiosum muscle, is assist the ejaculation of male. So this is the function of the bulbous spongiosum muscle. Okay, and for the female, separate and cover the superficial parts of bulbs of vestibule. Okay, bulb of the vestibule and greater vestibular gland. Secretion of the so it's help in the secretion of the greater vestibular glands and tumescence of clitoris. Tumescence means erection of the clitoris also, this muscle, bulbous spongiosum muscle. Okay, then ischiocavernosus muscle, this is male and this is the female, and the lateral part. Cover the crust of the penis, okay, in male, to maintain the penile erection. Okay, so this is the function of the muscle, and also it relates with the stimulation of the clitoris also in female. So this muscle is this is the function of this muscle of the perineum. Okay, now we go to the anal triangle. Okay, this is the anal triangle here. This posterior half of the perineum, not anterior, posterior half of the perineum, lined by the superficial fascia of the anal triangle and deep fascia of the anal triangle. Okay? So the deep fascia of the anal triangle lines the inferior surface of the levator ani and is continuous with the fascia of the obturator internus. It's bounded by the coccyx, sacrotuberous ligament, and imaginary line between ischial tuberosity. So it's contained anal opening. Okay, external anal sphincter. Okay, external anal sphincter muscle, and also ischio-anal fossa. Okay, some of the book mention that perineal body is located in the anal triangle. Some of the book called perineal body is located midline between those triangles. So I tak tanyalah dekat in the exam lah dekat mana perineal body, because somehow it's very vague also the location of the perineal body. Okay, so a fossa ischio-anal, some of the book called ischio-anal, some of the book called ischio-rectal. Okay, so it's the same. So what is the fossa? Okay, horseshoe-shaped region filled with loose animal tissue, internal pudendal vessel and nerve, okay, inferior rectal vessel and nerve. Okay, anal canal and its sphincter lie in the center of the horseshoe. Okay, anal canal somewhere around here. It macam yang ni look like the horseshoe. Okay, pudendal canal and vessel here. Masuk ke okay, nama lain pudendal canal and box canal. This is the pudendal canal. This is the anterior view of the anal canal. This is lateral. Okay, this is the right side. Okay, the pudendal canal here, a sheath derived from the fascia of the obturator internus. Ingat dia terbentuk, this pudendal canal terbentuk from the sheath of the obturator internus fascia. They share same fascia with the obturator internus. Okay, so lies on the medial surface of the obturator internus. This is the obturator internus here, warna coklat ni. So medial surface of it, and medial aspect of the ischial tuberosity. Okay, this is ischial tuberosity, medial semua kat sini. So dia dekat dengan ischial tuberosity punya medial aspect. Alright, so what are the contents of pudendal canal? Pudendal nerve, internal pudendal artery, and internal pudendal vein. Okay. So what are the boundaries of ischio-anal fossa? Superiorly, a deep fascia over levator ani. Okay, this is levator ani. Anteriorly, fascia over obturator internus and periosteum of the ischial tuberosity. Anterolaterally. And posterolaterally, sacrotuberous ligaments. Okay, and gluteus maximus muscle. Sampai kat belakang. Okay, sacrotuberous ligament and gluteus maximus muscle form the posterolateral boundaries of the ischio-anal fossa. Okay, so the anterior recess lies cranial to the perineal membrane. Okay, and transverse perineal muscle and extend the pubis below levator ani. Posteriorly, the fossa contains external anal sphincter. This is posterior recess. The fossa, this one is the posterior part. Contains external anal sphincter through coccyx above and below this. It uninterrupted across midline. So they boleh cross left and right. Okay, left and infection at the ischio-anal fossa, especially at the posterior recess, posterior part, it can connect contralaterally. Okay, so it's dangerous. So any infections, tumor infiltration can infected to the opposite side. Okay, it's not as them applied at anal area because it tend to become infected because it's site located at the anal canal below levator ani, pelvic because due to pelvic infection. And located underneath perianal skin, okay, wall or operation of perineal skin. Okay. affected. So this area is easily become infected. Okay. So internal pudendal artery, a branch of the internal iliac artery in pudendal canal, 4 cm superior to inferior limit of the ischial tuberosity. Okay. Branch, tadi I cakap, deep and dorsal artery of penis and clitoris. Okay, this one. Inferior and rectal artery and perineal artery. Okay, it will supply the posterior scrotal artery in male or posterior labial artery in female. Okay, vein, tributaries from the inferior and rectal vein, branches from the penis and scrotum, and branches from the labia and clitoris in female. Pudendal nerve in perineum. Okay, so its constant position over the ischial spine. Okay, I cakap tadi dia dekat. It's constant, always dekat ischial spine. Untuk bagi LA injection, local anesthetic of the pudendal nerve block, we have to identify the ischial spine. And there is a branches of the perineal nerve, inferior rectal nerve, and dorsal nerve of clitoris or penis. Okay, so perineal nerve ada posterior scrotal or labial nerve. Okay, this one. And also the muscular branches, this area. This is inferior rectal nerve and dorsal nerve of clitoris or penis. Okay. Yeah, dorsal nerve of penis.
Belum kena
this one. Alright, so I think